Welcome back. I'm Dr. Lisa Hernandez, and this is your health television program. Today we've been discussing teen pregnancy, as May is Teen Pregnancy Awareness Month. My next guest is Sharon Barnett, and she's a public health nurse 3 from the Monterey County Health Department. Sharon has been working for the health department for 20 years, and she's currently the lead on the teen parenting program that focuses on working with teens who are either pregnant or who are new parents. Thank you, Sharon, for coming today.
Thank you for having me, Dr. Hernandez.
Yeah, I was surprised to see the 20-year thing, but I know that you are a wealth of information, and we're switching gears a little bit, talking about parenting as opposed to prevention. Can you talk about the teen parenting program that you're leading?
Well, heretofore with the Monterey County Health Department, we used to have a dedicated case management program for pregnant and parenting teens, and because of fiscal issues, that particular program was outsourced, if you want to call it, to another department. And within the past several years, because of our continued high rate of teen pregnancies in Monterey County, health department officials decided that they wanted to have a dedicated program again servicing teens within Monterey County, and we submitted an application to Monterey County First 5 to assist us in my glasses dropped, servicing again young teen moms. So there's myself, and as a public health nurse, and 2 other nurses who are licensed vocational nurses who are dedicated to providing comprehensive case management services to teen mothers within certain areas within Monterey County.
Well, I'll let you get your glasses if you'd like, and I can ask you the question, because I think you could do both.
Thank you.
With this program, Sharon, talk about teens. Can you define the population, like which teenagers are able? Is there a certain age group? Is there a certain areas of the county? When Rose and I were talking in the first segment, we talked about the hot spots. So can you talk about which are the target groups and where you're going?
Presently at this time, we have several areas that we're targeting. The 93905 zip code within Salinas, the city of Salinas.
So what's that?
That's within East Salinas, the eastern part of Salinas. 93901, which is a more northern part of the city, and 93906, which is again a few slots in the northern part and the southern portion of the city.
Of Salinas?
Correct.
Okay.
And then we have targeted areas in South County, which is Gonzales, Soledad, Greenfield, King City, and about 2 slots for San Ardo.
Oh, wow. So with the staff of 3, essentially, you're taking on that huge segment.
Correct. And at this time, we're not providing case management services to young ladies who live on the Monterey County Peninsula or up to Pajaro. But that doesn't mean that we don't provide services to pregnant and parenting teens who live within those regions. There are other public health, regional health team staff that will provide case management services for them. But at this time, the dedicated teen program that we have funded through First 5 is for primarily East Salinas, parts of northern and southern South County.
Okay. And what are the roles? What you mentioned that, well, you're the public health nurse, and then there's the 2 licensed vocational nurses, LVNs, that do that. What do they do with a teen?
Generally, I'll start with how we get referrals, if we could.
Yes.
We get referrals from a variety of sources, from our 2 hospitals within Salinas, mainly the Natividad Medical Center and Salinas Valley Memorial Hospital. The social workers will send us referrals on postpartum for women who've had, young teens who've had their babies. And also from South County, Me Memorial Hospital. We get them from our primary care clinics, from Natividad Medical Center, the Department of Pediatrics, Laurel Pediatrics, Laurel Family Practice, Alisal Health Center. We also have teen mothers who self-refer. They hear about us, they see our flyers posted in the Department of Social Services. So at that time, I will be the first one to contact that mom. I then in turn offer her a home visit, and I make the appointment, and we'll visit with her if it's during her pregnancy, and if she's had her baby, I will make the home visit and we'll evaluate her, assess her, recovery after having had the baby. I will weigh the infant, assess the baby, do a complete physical assessment from head to toe, breastfeeding, counseling, and assessment, help the mom get on track if there's breastfeeding difficulty, and in turn make appropriate referrals to community organizations such as WIC, Medi-Cal, Department of Social Services, etc.
Wow. And you do this in one visit?
One visit. Well, depending upon the circumstance, I might see the young lady perhaps 2 or 3 times. Our 2 licensed vocational nurses are Barnett, Hernandez, and Eusebia Ortiz. Eusebia presently works out of the King City Health Department. We have a health department in King City, and Barnett works in Salinas. And so they would either accompany me at the second or subsequent home visit to meet the mom, for me to introduce them to each other. And then in turn, the licensed vocational nurse would make the subsequent home visits with the mom and the baby.
So basically, you have 2 patients or 2 clients that are being seen and are benefiting from this program. Initially, it might just be mom,
Correct.
But then at some point, it is mom and baby.
Right. We can see pregnant women. Some are at the latter stage of their pregnancy. The vast majority, I would say, are anywhere from 5 to 6 months, give or take. And so during that time, it's a prenatal assessment, education, labor education, plans for their labor and delivery, how can you say, contingency plans, making sure that they're ready to have the baby. Do they have housing? Some young ladies are in a state of flux, so it might be making appropriate referrals for housing, assessing their social support. Are they living with their mother, their father, their parents? Is the father of the baby involved? So it's how is this young lady prepared to welcome this new baby into her life? That's an important part of the prenatal spectrum.
Of this part, yeah. And how long is the program? So once, if you have a mom who is enrolled in the program and she hasn't given birth yet, how long can she participate in the program before she delivers and after? What's the total time frame?
Our program is voluntary, and we are recruiting for young women now, presently, and it's for 12 at a minimum 12 months, up until when the baby is 12 months of age. At any time, should the mom want to stop or to say that she would prefer not to participating longer, we respect her wishes, but we certainly encourage her to call us back if she chooses to participate at a later time. So we are able to work with this mother at periodic times in the baby's life to offer them comprehensive case management services.
Okay, and typically, do you see the mom and the baby once a month, or does it vary depending on the needs of the family?
It could be both. Typically, it is once a month, or it can vary depending upon the need of the baby. But typically, I would say once a month. Once a month, we visit them at a minimum twice, depending upon their lack of social support. Perhaps maybe this mom has some depression. She might be seen more frequently than, say, somebody who has a more wider net of support in her home. So
do you mentioned depression, because I think that's important to talk about. Do you offer screening for depression, or do you just do your assessments, and if you see those sort of cues that make you concerned, do you offer additional referral or refer them back to their provider?
That's a great question. We do, and more often than not, many of the teens that we serve either have a history of depression. The ones that I have worked with have had history of suicidal ideation or previous attempts in the past. So that is a question that is asked, how they're coping with the pregnancy, any current depression, past depression. And if so, I do make appropriate referrals to our behavioral health division and or other community-based organizations that offer supportive therapeutic counseling services.
Okay. And maybe I missed it, but what is the eligibility criteria for the program besides living in a specific area of the county? What is the age range?
We're looking for young teens who are between the ages of 14 to 19.
Okay.
And the criteria also is that they live in the particular targeted areas that I spoke about earlier, and that they either be pregnant or parenting a child under the age of 12 months.
Okay.
So the baby can be 12 months and under.
Okay, great. Well, you talked about visiting the mom and visiting the infant once the baby's born. Is there a specific curriculum or program that you're using that you're applying universally to all the clients that are in the program?
I wouldn't say that we use a specific curriculum, but we are utilizing if you want to call it a conceptual framework, pioneered by Dr. T. Barry Brazelton, who's a world-renowned eminent pediatrician with over 60 years of practice experience as a pediatrician. And we all three went back to Boston last fall for training at the Brazelton Institute to get initial training in what is called the touch points principle, the touch points guiding principles, which is mainly that respecting and honoring parents where they are, and being able to provide supportive service, a network for that parent to be able to anticipate the growing needs of their baby, specific touch points, specific spurts of development, so that parent is better able to anticipate as to what to do for their baby, and perhaps not view that development as something that's either bad or wrong, but as something that's natural, expected, and at the same time there's an ebb and flow when it comes to the development of a child, that children can digress as they progress.
So you basically assess the mom and the baby and give parents cues or clues as to assessing where their babies are, or how do you apply that to your clients?
Well, one great tool we use, Dr. Hernandez, is what's called the Ages and Stages questionnaire.
Okay.
It's a very well-known screening developmental tool that we can administer to babies at certain stages of their development in order to make sure that they're on time for their developing speech, their gross motor movement, their fine motor movement, their ability to interact with their families, their relationship with the world, to help the parents learn more about that baby's growth and development. And it's a great thing to see how a baby can develop in time, and it's a way of teaching parents and what to anticipate with what babies can do or perhaps are not ready to do.
So you're testing these babies, and they're so young, huh?
I wouldn't say it's a test. It's a natural progression, and as to what babies, what they can do, from simple things as smiling, babbling, looking at their parents, eye-to-eye contact with a parent, which is so critical and so important. So it may seem simple, but we make it fun because it's a type of screening that the parent can do with us together.
I think that's really important. A lot of times parents, and it's been a while since I've been a new parent, but that we forget about the little interactions that we have with our infants and how meaningful they are.
One thing what we learned, or at least I took from Dr. Brazelton's training, is you take the child's behavior as its language. So by utilizing what a baby is doing could be a very powerful way to connect with a family member, that parent, as to how their child has a formative relationship with them. Just how I've seen babies look up at their mothers with a look of love, a look of recognition, affection, is very powerful, particularly with mothers who are depressed or there's some difficulty with connecting with their baby. It's a way of helping to seal and to gel that relationship between the mom and the baby. So using the behavior of the child as your language to communicate with the parent is a very powerful principle of Dr. Brazelton.
Oh, he's a neat fellow, and you had the opportunity to meet him.
Yes, we did. That was unexpected, but he was there during the training and giving guidance and information and mentorship.
Oh, excellent. Can you give us some examples of challenges your teens face with being teen parents?
On one hand, I would like to start with the strengths base, because that's what we try to do, is come from a strengths-based position. And so I would say many of the teens that we have worked with, many of them are not in school, so that's a challenge of encouraging them to get back into school, to high school. Lack of access to medical services. Oftentimes their medical care can be haphazard, or lack of prenatal care. Depression, family stressors, domestic violence, family discord, substance abuse. It's a wide range. But then on one hand, you have these teens that have a very strong sense of resilience despite all the obstacles that they face. And I think they need that support to know that they are strong people. And if it's just one person who can encourage and challenge them, I've had great success with many that I've worked with. The power of one is very important.
I think that's a really important point to end on. Believe it or not, Sharon, our time flew so quickly. Thank you so much for being here.
Thank you.
You mentioned that teens are often referred by the medical professionals, the hospitals. If a teen wants to self-refer, should they connect with you through the health department?
They can call me directly at 831-755-4898. That's my direct phone number.
Look for Sharon Barnett. Today we've learned a lot about teen pregnancy and prevention and the resources we have in the community. We have a number of resources through the Maternal Child Adolescent Health Program, Planned Parenthood, and other facilities. We have a teen parenting program, which Sharon Barnett is the lead on, and there are a lot of resources for teens and their parents to look into. I want to thank Sharon
Thank you.
and the other guests today for joining us. Thank you and goodbye.